Hey YouTube, long time no see. It has been, I don't even know, like half a year or something, so sorry about that. But I actually have stuff to talk about. Some good stuff, some not so good stuff, I don't know. So, on the road to surgery, a very, very long road it will be, but at least I'm on that road. Yeah, so I'm starting to save for surgery. For lower surgery, and it's still in the very beginning stages of a savings, but it's something, and it's kind of giving me motivation to seriously look into the various procedures, because I've looked at the Trans Bucket and the Yahoo groups pictures for years. Now I'm actually being a little more critical and like, do I like certain techniques, all that stuff. So yeah, let me start with a couple things. So, I've been losing more hair, as you can see. So I got a prescription for Propecia. I haven't taken it yet. And then I looked online and read more about the side effects. And then I saw something about this guy who basically became really depressed and like his genitals shriveled up or something like that. So I don't think I really want to take Propecia. So I just gonna have to deal with the hair loss. I don't do the like Rogaine stuff because I researched that and it's highly toxic to cats, and as you know, I have a critter, so that's not gonna work. Also, I have a prescription for DHT cream. Very exciting, right? However, it's completely not available in the States. So that's kind of useless. We have to look into Canada. I don't know, but I have a prescription for it, so it's not illegal if I buy it internationally or something. I don't know. So I don't know if that stuff really works, but I thought, what the hell? It can't hurt, I don't think. Hey, Puff. Okay, so I really want to talk about some of the logistics that I'm dealing with right now. So in order to have lower surgery, you got to have 2 letters, and I have one somewhere from my top surgery, and I think that will be acceptable as one. And then I have to get another one. So I've started therapy, but here's the deal. Meltzer wants 1 letter from someone with a master's, and the other letter from someone with a PhD or MD, a doctorate, something like that. And so I was like, this is really, I'm really irritated with the fact that I've transitioned for several years and I have to, get these letters. It's like, dude, yeah, I know what I'm doing. I don't need someone to tell me what I need to do, but I understand that these are the guidelines. I think it's basically everyone covering their ass. That's all it comes down to, is that, for the 0.005% or whatever it is, tiny, tiny, minuscule amount of people who regret the surgeries, they kind of ruin it for everyone else. So, alright. So I'm seeing a therapist now, but I don't know, I don't really vibe with him too much, so I think I'm going to change therapists. I can't afford like licensed therapists because I don't have insurance, so I have to pay out of pocket, which brings me to another kind of a frustrating topic, which is a whole other thing, is really, if you are a service provider for the transgender community, why the hell would you charge like over $100 per hour for a therapy session, or over $100 per hour for a clinic? It's ridiculous, but that's a whole other rant I have for another video. Anyways, so I have interns that I'm, capable of choosing between, among, whatever, and so I don't know. I'm kind of in this position where I want someone that has enough knowledge and background that can kind of understand the decision because I really don't know. So I'm actually utilizing therapy because I really don't know if I want a phalloplasty or a metoidioplasty. Yeah, and I think what I've come to the conclusion to is that I don't think I want a therapist to be in my community. He's trans, on the trans spectrum, and I don't think I need someone that's a little more objective. I thought I would want someone in my community. I thought that would actually be cool, but it turns out that politics are really kind of funny within the community, and even therapists, I think, have a hard time separating their own issues and whatnot. Anyway, so that's therapy. There's the letters. Okay, so in terms of the surgeries, I haven't decided if I want a meta or a phallo, and I go back and forth on a daily basis. It's been kind of tormenting me. You know, obviously, and this is just where I am at with the process. So hear me out here. Obviously, you guys have heard these pros and cons before, but with the meta, which I'm drawn to for all the great reasons that everyone else is, you know, it's less expensive, it's less invasive, all that good stuff. I can kind of move on with my life sooner than saving up much longer for a phallo. But here's the thing about the meta, and I kind of realized this. Okay, so yes, I want it for package at all. And that does bother me. Because, you know, I go to the gym, there's situations in which I can't tell you how many times that even just interacting, like, you know, dancing with somebody or working close with someone, that it kind of, you know, penises tend to, like, accidentally rub against people, or I don't know. But anyways, like when I worked at the restaurant, it was like really close quarters, and I can't tell you how many times, like, I was glad that I packed, because if I didn't, it'd be kind of like suspect, like, Chris doesn't have a package. It's not intentional, and I know that, you know, the emphasis should be placed on, you know, your package, but it's a legitimate concern. And I swim as well, and I don't wear the Speedos, but I wear, like, what look like, they're trunks, but they're like boxer shorts things, and I pack, and I would have to wear trunks, like surfer trunks, to go swimming if I didn't pack, because it'd just be really embarrassing. And I've been having, like, anxiety issues around showering lately, and that kind of came up all of a sudden. I was able to shower before and change, but yeah, just one day I worked myself too hard, and I kind of crashed and almost passed out in the shower, and that kind of scared me, because I know that's really not where you want to pass out, whoever you are, but specifically if you're pre-op transgender. No. So that really made me think about it. And then the clincher really is that if I'm going to spend thousands and thousands and tens of thousands of dollars on a surgery, and then I still have to use a strap-on for sex, that's going to piss me off. And I'm going to regret that, I think. I'm definitely going to resent it. And, like, what if I can't clear my fly? Then I'll have to use, like, a peeing device or sit down. These are the things that really worry me about the meta. And there are several guys, like, these are not outliers. These are guys, many of them, who initially do the meta and then go for the phallo. So that kind of worries me. Will I be one of those guys that's like, yeah, I need more? But the phallo, man, it's so expensive. And that means I'd have to be saving for, like, years. And that just means I have to just totally focus my life centered around this surgery. And it's, I want to kind of move on with my life. I'm getting up there. I want to be 39 this year. But it is appealing, you know, to think that I can kind of be free of most of the dysphoria. I don't know. But I love playing the piano, so I don't know if I'm willing to risk losing function of an arm for the free, whatever, forearm flap for that, whatever the hell it's called. And yet there's really not a lot of sensation with the abdominal ones, so I don't know. It's tough. I don't really know what to do. I made a survey because I was curious to know what bio guys would do. And I should probably post the questions. I don't know how I'm going to do that, or maybe I'll have a link to the survey. Actually, I made two. One for men bio guys to fill out that really kind of guide them through the process of like how important their penis size is, blah 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 blah. And it's really interesting. And then I made one for women about their partner's penis, even more enlightening. That was actually kind of depressing because it turns out that women would rather have, at least this small population of women, 40 some on 30 something, 40 some, would rather have their partners have a phalloplasty than a micro penis. That's how I worded it. Things to think about. And I know that there would be some chick out there who would dig my stuff as is, but it comes down to, I guess, how I'd feel comfortable and, you know, how I can express myself sexually. Would I feel stunted not being able to express myself with the meta, or would it be, you know, weird having this piece of my body attached to another part of my body? I don't know. So that's where I'm at right now. And yeah, I'll try to figure out a way to get those results. Alright.